Okay, good morning, everyone. Welcome to GlomCon Hawaii 2024. I will be providing you with an overview of the GlomCon Foundation. As you may know, GlomCon is among the youngest of the nephrology organizations around, globally active, and many know about GlomCon, and some know some things about GlomCon, but few know everything about GlomCon. Before getting started, I want to, however, thank few people. Number one, the faculty, to coming in on this inaugural event and be willing to share their time and expertise with our global community. I want to thank our sponsors to taking this huge leap of faith of sponsoring and supporting an event that has no precedent and no track record. So we appreciate that willingness. And we planned it in Hawaii as a mode of kind of maybe considered de-risking the event with when, in case everything goes wrong, there's still safe spots to enjoy and to have a good time among colleagues, such as in anyone strikes or the streaming doesn't work or whatnot. No one cares. But that was not the reason actually why we picked Hawaii. We picked Hawaii because we think nephrology deserves it. It shouldn't be always the ophthalmologist, dermatologist, and cardiologist holding their professional events here, but nephrology, who is quite dealing with sick, multi-morbid patient, usually working overtime and providing a longitudinal care for their patient that goes above and beyond. I think we deserve being in the paradise once in a while for our meetings. I want to also thank my conference co-chair, Dr. Saina Nourouzi, who is also the director for the CME program for this event, who conceived this event, planned it, organized, and without whom we wouldn't have an in-person GlomCon event altogether. She has been working over the past several months very hard in coordinating with speakers, faculty, our moderators, and the CME office to pull this together. That has been beast, so to speak. And everyone who has done this type of event also knows that it wouldn't be possible without having people at the back end making this all possible on an administrative level. Katie Ta, our administrative director of GlomCon, and Rika Pitogo, our senior project manager, whom most of you all know and have interacted with. They basically not only shouldered this event and carried it to the finish line now here, but all GlomCon is standing on their shoulders. And to give you an example of how much they are cautious and involved with ensuring that I don't mess anything up, yesterday I was reminded to make sure I'm shaved for today and ready to go. And that they are supported by our additional team members, Marianne and Melanie, who support and do all the little tasks and works that move along with invisible hands. And of course, the education committee for helping put the agenda together, working on each sessions, organizing the slide decks, the cases, case presentation, pathology, clinical slides, and all those things together, and preparing really, working with Dr. Nourouzi and the faculty to really make this a very unique and valuable educational event. And the social media committee, who is here to ensure that the knowledge shared here is also shared everywhere. Lastly, also a big thank you to the Kari Strawman, Amanda McLeish, and Sherry Austin, and the entire audio team for helping for the coordination and management of this event all together. Okay, so this is 2016 when we started GlomCon. GlomCon was initiated as an academic project to basically fill a void that we felt was in clinical exposure to complex rare kidney diseases and an opportunity to engage in a collaborative research project. We brought that together as a mode of 2 more board-style case discussion within the community around Boston, and wanted to leverage these case discussion to bring in patient into a registry and allow the build and creation of a collective network registry on patients with glomerular diseases. For nearly 6 months, we were meeting on a monthly or bi-monthly basis. It was less than a dozen of us who enjoyed these events and discussed the complex cases that were referred by a nephrologist or pathologist reviewed and a clinician discussed. And then we made these sessions open to the broader community in the Boston metropolitan area and Massachusetts. And it took off. Within the next year, up to 200 people slowly signed up to participate in this. And it was very well received. So we thought that perhaps we met a need that was not only our personal need, but perhaps also a need in the broader community at that time. So we conducted a survey to see what was it that people found particularly valuable, what other suggestions they may have, and to assess the overall impact of the program. And we received an overwhelming amount of positive and supportive feedback at that point. And one question that stood out and one response that stood out was that 98% of the respondents of the survey noted that to the question whether the conferences improved the care of their patient with glomerular diseases, affirmatively found to be that the case. So this was encouragement for us to keep going and to further opening it up to a more global audience. And since ever then, you can see the number of people who sign up to basically participate in our weekly seminars continues to increase up to date. And the most striking thing is that is not the number, is not the total number of the participant that is now more than 7,000, but the slope. The slope of the rate of the people signing up to join has not abated. It's similar to GFR, an important aspect to look at. And if you had invested in GlomCon back in 2016, you would have beaten the S&P index. S&P in 2016 was at 2,000 points and now it's 5,500. GlomCon was at 0 and it's now more than 7,000. And I say with investment also because many people truly invested. They didn't invest money, but they invested time, blood, sweat, and tears in making these possible, running the conferences, the seminars, and many other things that I will be telling you about. And that to some degree, hopefully, I think have paid off beyond just the joy of doing this, but also in regard of career advancement, career fulfillment, and so on. And this is the representation roughly from 2 years ago. It takes some time to map everyone who is joining and participating in GlomCon, but it is a truly global audience with almost every location involved. They come together to join and listen to Sunday seminars that are led by Dr. Dia Waguspag over the past several years successfully in a series of all level of discussions, from controversies to clinical management to latest in the therapies. We have the transplant series that was launched and conceived by Dr. Mario Rubin, and in its first year hugely successful in 2022, and then passed on to Dr. Qasim Safa, and now run by Dr. Ayman Al-Jordi on once a month, all things around kidney transplant, which is a topic as complex and intricate as glomerular diseases. And we have collaborative sessions with the International Society of Nephrology and Renal Pathology Society that are very successful on all topics around computational pathology, AI and image analysis, and also the global perspective from the leadership at ISN. And we have made a fraction of these seminars online on YouTube available. So roughly 180 you can see on YouTube. And we have garnered around 10,000 subscribers to our channel. And just because we compare ourselves with established entities to assess our impact and relevance and success, you can see that the American Society of Nephrology here has posted more than 600 videos for roughly 3,000 subscribers. So I think the content we are doing is on the right track and overall meets an unmet need that is appreciated. And altogether, perhaps you can see on the Google Analytics and the YouTube Analytics that there are 3 countries that haven't watched those videos. Otherwise, all countries represented with a total of more than 600,000 views so far. We have made these seminars accessible through mobile app. You can go download it, My GlomCon app, which is accessible for the paid subscribers. We have 2,300 of those, around 117 countries who are joining. We have many fellowship programs who sign up their fellows for access to these seminars. And we have some fellowship programs who incorporate the GlomCon, both the conferences as well as the fellowship, into their didactic training. Speaking of the fellowship, the Glomerular Disease Fellowship Program that was launched in 2020 by Dr. Kate Robson, Dr. Harish Sitapati, and Dr. Saina Naruzi. This is perhaps the most significant and impactful of the GlomCon initiatives that were launched. They are supported by a crew of course instructors, all of whom are in various degrees of their early career in developing GlomCon, glomerular disease clinic, engaging in clinical trials and clinical research. And over the past, now going into its 5th year, over the past 4 years, we have had 1,700, more than 1,700 applicants worldwide, of whom we took roughly 543. The acceptance rate ranging anywhere between 10 to 40%, and successfully graduated since 2024. And we make this fellowship available for free for nearly all applicants from low-income countries. We ensure that many applicants, unfortunately not all, but many applicants from middle-income country receive scholarship to join at a reduced rate. And that's through both internal support from GlomCon as well as general support by the faculty who forgoes their honoraria, which is passed on as in form of scholarship to the participants. In 2022-23, we dedicated around $7,000 to that, and in 2023-24, $12,000, and this continues to increase. We are now in the 4th year of a pathology certificate program with nearly 500, more than 400 participants joining for more pathology-focused training led by Dr. Vanessa Bijol. And we have several local-based regional chapters, the most prominent one being the GlomCon Ibero-Latin America, which is basically GlomCon in Spanish. Initially conceived and launched by Dr. Blanca Martinez and Javier Soto from Mexico, and joined by Dr. Carmen Avella, Jocelyn Reyes, and now Alejandro and Sol, who are in the team, and basically conducting every other Saturday, seminars in Spanish, and now led by Dr. Jocelyn Reyes, also a fellowship in Spanish this year for the first time, opened the application. Within the first 3 days that we had 40 applicants already for this program, again, signifying unmet need and the value of these type of programs for them. Dr. Carmen Avella is launching a similar pathology-based certificate program, also in Spanish, with the application actually opening as we are speaking. And we have other chapters as well, and one of the most successful being by Dr. Joana Amiro from Portugal, leading the Portuguese chapter in GlomCon, which is basically seminars in Portuguese, along with research collaborative activities and educational events. Similar one is led by Dr. Edward Kwaji, GlomCon Ghana, with several symposia and events for the Ghanaian, Nigerian, and colleagues from Central and South Africa. And most recently by Dr. Song Liu, GlomCon China, that already in its 3rd event amassed more than 700 participants with already a huge number of participants on the WeChat, which is basically the Facebook and Twitter of Chinese community. To bring all these clusters of cohorts together and people we have in GlomCon Network, which is both on the desktop as well as in the app. You can go to the Apple App Store, GlomCon Network, download, and I encourage every physician and patient to join this. Is basically bringing the community in a closed environment together. Patients can find the physician in their neighborhood on a map. Colleagues can identify each other based on background and interests. And patient can identify clinical trial sites and opportunities in participating in clinical trials based on diagnosis and location. We have now the Glompedia, which is led by Dr. Sonia Rodriguez and supported by her co-editors, Dr. Edgar Lerma and Harisita Pati and Jean Hu, which is an ebook basically on an Apple App Store and Google Play to cover all topics on glomerular diseases. And we have had the GlomCon Pubs, which is basically blog. Started as a blog for glomerular disease publishing, led by Dr. Nasim Weekly and her co-editors and deputy editors, and mentored and supported by Dr. Edgar Lerma, who successfully together published several articles, not only in the form of the pubs, but also in kidney medicine as a collaborative and many other peer-reviewed journals. Recently joined by Dr. Olivia Schreiber. Many of you have got to know her in the latest newsletters over the past several months, writing the editorial introduction to the newsletters that has grown, received extremely well. And now Dr. Orhan Ife basically taking this next steps of outlining a very ambitious goal for the next 36 months to launch a publication that would start with ISSN and DOI registration all the way to Medline, PubMed, Web of Science, and ultimately securing impact factor for a journal that would be serving autoimmune kidney diseases, glomerular diseases, and the like. To provide education to the patient level and patient and clinician level, additional about clinical trials, Dr. Manasi Bapat is leading the effort for the clinical trials information and support portal that is accessible at enrollmypatient.org. We refer to it as a platform to help hope find opportunity, where we want patients to be able to readily understand about clinical trials opportunity, and physicians identify appropriate trials for their patient in a curated and digestible format. These are accompanied by high-impact clinical trials interviews that are led by also Dr. Bapat and Dr. Vinay Srinivasan. You can access that on YouTube, and they have been very well received, and more of those to come. And we have an emerging therapeutics section that is dedicated to educating about all therapies on the horizon or recently approved to learn about. To support the patient on their needs about patient education, we have now various PDFs that can be downloaded from the website to handed out in patients in their clinic. These materials are available in English, in Spanish, in Portuguese, and we hope to also expand it to all the other languages. You can download them on the website. You can order them from GlomCon to be basically placed in the clinics to be handed out to the patient. And beside all the instructors who helped develop these, this has been led by Tejwinder Sandhu, who is not a doctor yet. He's a medical student, and supported by Dr. Anna Naidas. And to provide also more interactive opportunity for patients to engage with physician and physician experts, we have now the PACE program, which is the patient and caregiver engagement, which is basically the GlomCon Sunday seminars for patients. So patients can join live seminars every other week and engage with a clinician led by Dr. Tripti Singh and the patient and caregiver perspective by Tony Martinez to join these events, ask general questions and learn about glomerular diseases, treatments, and general diagnostics. So the other major activity and program within GlomCon is the GlomCon Spark. That is the strategic program for advancing research in kidney and glomerular diseases led by Dr. Michael Walsh, which is basically a program to enable and be a catalyst for research operation and activities. Whether it is forming and developing research grants from GlomCon for the broader community, developing research infrastructure from registry portal to virtual research training similar to GlomCon Fellowship, or providing access to a mentor-mentee network, and ultimately collaborative activities such as EDC development, protocol development, IRB, and so on, that can serve both for investigator-initiated as well as sponsor-initiated research activities. As the first under this program, we committed and provided $190,000 of funds for 8 grant recipients this year. You may have seen the announcement for junior nephrologists to jumpstart career in glomerular diseases on clinical research. 3 recipients were from US, 2 from India, 1 from Sri Lanka, and 1 from Ghana. And we look forward to seeing their research and success in the coming years. Kidney Disease Registry, which is the other platform among the Spark program, which is basically an open source distributed network and decentralized registry. So contrary to the classic registries where data is collected in a centralized manner and through giving out ownership and access, this is decentralized, meaning every entity has and retains its own registry, but the collaboration is enabled through standardized collection forms and data definitions. The first study of such was a real-world evidence study of FSGS that 9 medical centers came together to conduct, and hopefully having this data soon before the end of this year, with more than 720 patients enrolled in this study, one of the largest studies in FSGS and supported by Travere Therapeutics. And to further expand the capabilities of these type of collaboration, GlomCon is in a formal partnership with Bain Institute run by Mike Gibson, whom some may know, who have basically had success in more than 50 FDA submissions thus far. And we hope to leverage both their infrastructure and expertise for studies that may require biospecimen collection, network, and more complex activities. The other initiative where we are very proud of is around thinking about the pipeline in nephrology. The MEPIN initiative, basically mentored internship program in nephrology, is led by Dr. Genston Hall and launched this year for the first time, serves to basically bring in trainees and college students and expose them to nephrology and nephrology laboratory, particularly trainees from underrepresented minorities. This year, we already had 3 successful applicants who, in collaboration with Duke University and North Carolina Central University, received $65,000 from GlomCon to enable a 1-year longitudinal mentorship program with their mentors. So you can read about all these things in detail by going to GlomCon's website, which has all this information in detail listed. And join the more than 40,000 people over the past 6 months who come and visit our website on a regular basis. We look forward to today's event, inaugural in-person event that many have asked for. GlomCon was virtual for many years. So this may basically represent a start. So big thank you to all here being today, signing up, and also big thank you to the overall GlomCon community all along the last 8 years to bringing us here.